At that time, the whole climate was very different. I mean, there was competition, and there was the Democrats and the Republicans and so forth. But people both in the Congress as well as in the Senate basically felt like they were being elected to represent people and work toward trying to do the public's good. They were quite interested in literally trying to work together. I say quality of care was one issue that was really of interest and concern. Workforce issues were always important. Where people were practicing, we didn't have enough primary care doctors where we needed them. The central cities had needs. Those problems have always been there, but they have their iterations, and they have their flow, and they have their ebb, and so forth. The Health Staff Seminar was a seminar that got together staffers from both the executive branch as well as both sides of the Hill. And so we would have regular meetings on whether it was funding medical education. At one point, we all took a trip for a few days up to Maine to look at rural health care. So I literally would get to spend hours with Phil Caper, who was Kennedy's staffer, or Jay Constantine or Bill Fullerton in Ways and Means. I was literally cheek to jowl, in the buses and everything, going and getting to know these people as though I was part of this whole thing. I really got a chance both of national as well as international dimensions of health policy. I had one magical evening in the Great Hall of the National Academy of a dinner for the first delegation of medical experts that had come from China, mainland China, to the United States. This was right after Nixon had opened up China, and so I was also there for an international event of really quite substantial importance.